PDIGREE is a trial we designed now over 10 years ago. It's an adaptive phase 3 trial, really optimizing immunotherapy doublets for patients with metastatic kidney cancer. It is a trial that we've run in the cooperative groups, and we enrolled patients from May of 2019 to May of 2024, over 5 years. And over that time, we enrolled more than 1,100 patients. So this is a trial of all patients with metastatic kidney cancer with IMDC intermediate poor risk disease, and patients were first treated with step 1, which was Ipilimumab, Nivolumab doublet, and at the 3-month responses, treatments were adapted for their radiographic changes. So patients with complete responses received Nivolumab, patients with progressive disease received cabozantinib, and patients with partial response or stable disease were randomized to either nivolumab or nivolumab with cabozantinib. Our primary endpoint was a 3-year overall survival. To improve that historical 60% to 70%, we needed about 553 randomized patients. This particular analysis that we're showing at ASCO 2025 is one of the step 1 demographics, step 2 assignments, and adverse events from step 1. And so this does not inform the primary outcome of overall survival. What we saw was that in this real-world population of over 1,100 patients, is a very diverse patient population representative of the U.S. population across the cooperative groups. Over 10% were Hispanic, Latinx, and also more than 8% were Black, Asian, or American Indian, Alaskan Natives. So that's a really impressive, I think, diverse patient population for the cooperative group setting. We also enrolled over 48% at community oncology centers across the U.S., and so really getting these immunotherapy doublets into the practices and hoping that improves our patient population outcomes. In addition, we also saw about 76% of patients with intermediate risk disease, 23% with poor risk disease enrolled to PDIGREE. There were a good number of bone metastases, about 27%, and also 54% of patients had de novo metastatic disease. When we looked at the step 2 enrollments versus step 1 discontinuation of these patients, we did see that fewer patients with poor risk disease, as well as fewer patients with bone metastases, were enrolled into step 2 than the population that discontinued during step 1. And of note, we saw the adverse events that we expect of immune therapies, so colitis, endocrinopathies, elevations in transaminases. Those were the main ones. We did see 15 patients who had grade 5 events from their adverse events, and that was a expected patient population from our more frail patient population, but it's certainly something that these early deaths on treatment are ones where we should take note of and try to improve upon. We enrolled over the course of 5 years, and over these past decade, really, as PDIGREE came into formation and the lifetime of the trial, we had over 7 industry phase 3 trials shape the landscape for metastatic kidney cancer. And I do think it is a testament to all the dedication from everybody. We had over 500 sites open PDIGREE, and over 450 investigators treated patients on PDIGREE. And so it's really important to note that this is really a Herculean effort, big effort from a lot of our cooperative group settings.